Hello and welcome to another episode of Health Matters. I am your health coach, Dr. Michael Chillemi. And on this episode, what we're going to talk about is back pain. I'm going to give you what everyone should know about it. So, we're going to tackle basically an issue that affects millions of people worldwide, lower back pain. It's not just an occasional inconvenience for many. For a lot of patients, it's a chronic problem that impacts work, relationships, and the overall quality of your life. But here's the thing, most people do not truly understand what's causing your back pain and how to address it properly. So, with that said, we're going to dive into a bunch of different issues and talk about it. I'm going to give you a pretty crazy fact. Did you know that lower back pain is the leading cause of disability globally? According to the World Health Organization, up to 80% of people will experience low back pain at some point in their lives, whether it's mild or severe. 80% of the people will have back pain at some point in their life. So understanding back pain and what it is critical to know how to treat it, right? So everybody's going to be subjective to back pain at some point and another. And if you never had back pain, you'll never understand how truly painful it can be. It can be one of the most debilitating pains you're going to have. You're going to be like, oh, come on, give me a break. If you've never had it, you don't understand. I've had to physically carry patients into the office because they couldn't walk. I've had to physically help patients sit, stand, bend, lift, move because they couldn't do it. Unless you really had the back pain like that, or sciatica, or radiculopathy, then you don't understand how bad it could be. But there is treatment, there is hope. So, in this episode, we're going to cover the types of back pain and what they mean, common causes of the low back pain, and tools and strategies to manage it, and even when to see a doctor. So, not all back pain is the same. Understanding the type of pain you're experiencing is the first step into managing your pain. So, first type of pain that we'll talk about is mechanical back pain. Mechanical pain is sometimes called axial pain, or that's pretty much one of the, or mechanical. It's the most common type of back pain. It's caused by issues within the spine, muscles, ligaments, or joints, especially the mechanics of your back. So just like it says, mechanical back pain, it's the mechanics of how everything's functioning. So what does it typically feel like? So that's typically pain that it's usually localized, means it stays in the area, it doesn't radiate. Radiate means it goes down your legs. Um, it usually worsens with movement, heavy lifting, or poor posture. So an example could be a muscle strain, a ligament strain, a facet joint problem with arthritis or degenerative disc disease. So basically, what this is it's localized, means it's pinpoint to one area, and that's where it is. And usually you get it from mechanical, whether you lifted something inappropriately, you twisted, you turned, you could even bend over, pick up a piece of paper, however the case may be, that's going to be the difference in what that is. Next type of pain we're going to talk about is radicular pain. Some people can call it sciatica, but what radicular pain is when a nerve in your spine, often one of your spinal nerve roots, is compressed or irritated. Sciatica, the sharp shooting pain that radiates down your leg, is a well-known type of radicular pain, right? So radicular means it just radiates down. So what does it feel like? It feels sharp, intense pain, numbness, tingling in the legs or feet. It may follow a specific nerve path. So in your lower back controls your legs. So L5 controls certain nerves that go down your leg, L4, L3, L2, and L1. So they're all different parts of your leg. So depending on where your nerve pain is going, that's going to be an indication of where you're theoretically compromised. So typically for something like this, we're going to look at herniated discs or spinal stenosis or foraminal narrowing. Key point to remember is radicular pain is often misunderstood as unrelated leg pain, but the root cause could be lower back pain. So I'm going to give you a tip. The tip is if you at one point have severe lower back pain and then you have severe leg pain with it, and then your back pain goes away, and now you just have leg pain, that is a worse condition than the initial with the back and leg. When you have, again, I'll repeat it, back pain followed by back and leg pain. Now your back pain goes away and you just have leg pain. Now you have a worse condition because now you're on the nerve completely. And that's time to go see a doctor. It's actually in the beginning, go see them before it gets to that point, right? So treatment, prevention, 2 ounces of prevention is a pound of healing, something like that. Okay. Next type of pain we're going to talk about is referred pain. Referred pain originates in one area but is often felt in another. In the case of lower back, referred pain might not feel sharp but rather dull or achy, extending into areas like the hips or the thighs. What does it typically feel like? It usually is not as intense as radicular pain and doesn't follow a specific nerve path. It's more widespread than a specific nerve path when you have radicular pain. Radicular pain is typically pinpoint to one specific nerve root, whereas referred pain is a little bit more wider spread. So some examples of this could be kidney stones as it relates to internal organs or your SI joint dysfunction, right? So something like that could be referred to as referred pain. Chronic pain. Chronic pain is defined as back pain that's lasting more than 3 months. While it often starts as mechanical or referred, it can evolve into more complex issues where the nervous system itself becomes sensitized to pain signals. What does it feel like? A constant ache, stiffness, or even sharp twinges that don't seem tied to specific movements or injuries. What's an example? Non-specific chronic back pain could be something like fibromyalgia, or cases where the original injury has healed, but the pain persists due to nerve hypersensitivity. Important note, chronic pain often has underlying psychological or emotional components such as stress or anxiety that amplifies your symptoms. So when you're in a heightened state of stress or anxiety, your body will send signals to the weakest areas. So if that happens to be your back, then your back can be magnified, right? So when you're in stress or anxiety, you magnify your symptoms. Okay, next, let's talk about acute versus chronic. Acute pain is short-term pain, usually from an acute injury or something that just happened, could last from a few days to a few weeks. Chronic pain is pain that's lasting more than 12 weeks, often involve in complex underlying factors. Okay, next, let's talk about what causes low back pain. So first thing we'll talk about is muscle overuse or strains. It's the most common cause of acute back pain, especially if you've recently overexerted yourself while exercising or lifting something heavy. Next is posture or sedentary lifestyle. So sitting too long, you're not alone. A lot of people do it, especially today in the computer age. Many people experience low back pain due to bad posture or extended periods of sitting without proper lumbar support. So here's a hack. Ensure your desk and chair supports the curve of your back and you stand and stretch every 30 minutes for a minute to reset yourself, right? So that is the hack. So if you are sitting for 8 hours and you don't move, you don't get up, you get up, oh my God, my back. It's because you are sedentary too long. Get up, move. Okay. Herniated discs. A herniated disc or a slipped disc occurs when the soft gel-like center of a spinal disc pushes through its tougher exterior. This presses on the nearby nerves, causing radicular type pain. Degenerative disc disease. As we age, our discs in our spine lose hydration. When they lose hydration, they also lose elasticity, which can lead to pain or discomfort, especially during activities. Why? One of the main reasons why, when you lose hydration, so that big fat disc that's here gets smaller and smaller, right? We shrink as people as we get older. And the reason we shrink as people is because our discs dehydrate. And when they dehydrate, we shrink down. And when you shrink down, you can compress your nerves because the space you had, let's say you had a big space here, but now as you get older, that space got smaller and smaller because we dehydrated. And even though you had space in there in your nerve roots, when your disc dehydrates, that space gets smaller and smaller and compromised. So any little irritation will swell up, and now you don't have the space in there for your nerve to maneuver around. Now it lights up because of pain. Okay. Underlying medical conditions. You could have conditions like arthritis, where you have facet joint arthritis, or osteoporosis, weak bones, which can lead to fractures. You got to be careful. Scoliosis, which is the curve of your spine. Lastly, stress and emotional factors. The mind truly influences the body. Stress or unresolved emotions can cause muscle tension in the back. Stress is always amplified to the weakest areas. So when we're stressing out about certain things, we can definitely cause ourselves to have more and more pain. Okay, now managing and preventing. What do we do? Movement is key. The worst thing you can do when you have back pain is stay completely still, unless your doctor advised you to do so. Otherwise, gentle movements like light walking or light stretching or even light yoga, just light motions to keep your back flexible to prevent stiffness. Strengthen your core. Your core supports your entire back. Weak abdominal muscles put added stress on your spine. Try activities like planks, bird dog exercises, or Pilates for core strength. That's why in our office we like to do chiropractic and physical therapy together because we treat the spine and then we utilize the physical therapy for core stabilization and strengthening. The key putting those two together is patients get better quicker, heal longer, and have much, much better results. Okay, next, let's talk about ergonomics and posture. Set up your workspace with your body in mind. Adjust your desk and chair and computer so your spine is aligned, your lower back is supported, your head is straight, right? So you can use a lumbar roll or a cushion for extra support, right, to give you that arch in your back. It's important. Heat and cold therapy. You can use cold packs for inflammation. So if you have an injury, the first 24 to 48 hours, you can use cold. And then after that, you could switch to heat. Now, always keep layers in between you and whatever you're using, whether it's cold or hot, right? So you're going to use multiple layers in between. You never put either heat or cold on skin, right? Keep it separated. Never Another tip is do not lay on it, have it lay on you, meaning do not put it behind you and then lean back in your chair. It's going to go too deep and you can burn yourself. Be very, very careful. Okay, next, let's talk about regular stretching. So basically, you want to give yourself the ability to have some basic yoga stretches, whether you're doing the needed chest stretch or the cat stretch or the variety of different stretches that are out there. But basically, you want yoga type stretches, low force, light stretching techniques to get your spine stretched out. When to seek help. If your pain lasts longer than a few days and it is severe or it's radiating down your legs, you definitely want to seek medical advice. If you are experiencing bowel or bladder issues, that is an emergency. Then you should go straight to the hospital, right? Do not play around with that. If you are experiencing bowel or bladder issues, go straight to the hospital. Do not stop and go straight to the hospital. Okay, let's wrap this up. Lower back pain is incredibly common, but it's incredibly unique to each person. Understanding the types of pain, identifying its causes, And building strong habits around movements, posture, and stress management can significantly improve your life. Start small, focus on one thing that we've discussed today, whether it's fixing your posture, trying a stretch, consistency matters. So what I tell patients all the time, movement is life, right? So the more you move, the better you do. You don't want to stay stagnant. And I know a lot of times patients feel, oh my God, my back hurts so much, I can't move. Just light motion, light movements can really make the difference on getting you out of that cycle, right? So the biggest thing is when you have severe pain and it comes on quick and your body's tilted to one side or another, what your body's actually doing, your body's preventing you from hurting yourself. Pretty crazy, huh? Right? So if you're leaning to one side, your body's actually trying to get the pressure off the nerve on the other side. And it's doing that by twisting your body in a funky position. And when you try to move in the other position, your body will cause pain because it doesn't want you to do that because your body doesn't want to hurt itself. It's trying to preserve itself. How crazy is that? It's pretty cool stuff. And it just takes time for your muscles to heal, for the inflammation to calm down in there. That's why seeking medical attention, getting treatment will help get the areas calmed down because the body is great at swelling you up right away and stopping you from getting worse, but it's very slow in letting it release. So the faster you can get into therapy, the faster you get healed, the faster you get back into functioning again. Okay. With that said, if anything we said today can help you or a friend or a family member, please pass this along to them. What I've given you today is my opinion alone. Please don't take anything I said as medical advice. This is my opinion alone. If you have a medical problem, please seek your medical provider. Okay, with that said, back pain is not the end of the world. It's treatable, functionable, get you moving again. We do it all the time, every day in the office. So don't let it linger. The longer you let it linger, the worse it gets. Okay, as I always say, you only have one of these. So take care of yourself, take care of your spine, because your health matters. Till next time, I'm Dr. Chillemi. Be well, be safe.